Hi, my name is Gabriel Rodriguez, and I decided to do my project on the topic of sleep insomnia. It's a little brochure. There's a lot of mental illness and psychological conditions in the world, but today we are going to focus on sleep insomnia. Sleep insomnia can happen at any age and can happen to anyone. Is related to when you have persistent problems falling asleep and staying asleep. It can also be when you're waking up very frequent throughout the night, or you're waking up too early, or if you have ongoing worries about going to sleep. This can also be related to poor sleep habits, depression, anxiety, chronic illness, or certain medications. Some of the symptoms of sleep insomnia could be feeling not as well rested, impaired attention or memory, decreased motivation, or even fatigue. Insomnia could also drain your energy throughout the day and your mood, which can impact your work performance or your quality of life. According to the Mayo Clinic, at some point in your adult life, you may experience short-term sleep insomnia, which can last for days or even weeks. But some people have a long-term one that could last months or in some cases longer. Many people that have this always ask, what's the main cause and why it comes in the first place? According to Mayo Clinic, insomnia may be the primary problem to this, but it can also be caused by other conditions. These other conditions could include stress, poor sleep habits, if you're eating too much late in the night, or if your work or your travel schedule. The reasons why stress could lead to sleep insomnia is because many of the concerns you may have or worries could keep your mind active at night, and this makes it more difficult to sleep. Another stress factor that could lead to insomnia could be a traumatic event such as a divorce or like a death of a family member. Poor sleep habits are when you're sleeping irregularly throughout the day, and this can mess up your sleep cycle, making it more difficult to sleep, which can lead to you waking up during the night or sleeping at the wrong time. The way eating too much in the night could cause some night or sleeping at the wrong time. Wait. The way eating too much in the night could cause some insomnia is because it may make your body very uncomfortable while lying down, which will make it harder to sleep, and many people could experience heartburn or other conditions that are related to eating where it can make it harder for you to sleep. The way your work and travel schedule could affect your sleep is when you have jet lag from traveling across different states or countries, and the time zones are different, or if you're working late and early shifts that can alter your sleep schedule, causing some difficulty sleeping. Other factors that could cause some sleep insomnia could be related to medical conditions such as mental health disorders, anxiety, PTSD, or the medications you use, or the addiction somebody could have to caffeine, nicotine, or alcohol. Many people know the symptoms and causes of sleep insomnia, but at the end of the day, does lack of sleep do anything to our brain? Poor sleep can affect the brain and affect the ability for the brain to function properly. The neurons in our brain become overworked and less capable of optimal performance and different types of thinking. Over the long term, if poor sleep continues to happen, it could lead to a higher risk of somebody having a cognitive decline or even dementia. An analysis was covered and it said about an estimated 15% of causes in Alzheimer's dementia are attributed to poor sleep. Researchers show that sleep helps the brain conduct more important housekeeping, such as clearing out dangerous substances like beta amyloid proteins. In Alzheimer's dementia, beta amyloid forms in clusters that are called plaques, which can worsen cognitive function. Studies have found that even one night of sleep deprivation can increase the amount of beta amyloid in your brain. According to PBS NewsHour, losing sleep can lead to eventual brain damage. Scientists at Pennsylvania School of Medicine conducted a test on mice where that rotated periods of rest similar to a person that works shifts. After 3 days of testing, the mice found they found that the mice had experienced a cell death and lost about 25% of the neurons essential for alertness and optimal cognition. And the researchers concluded that this could also happen to humans. According to Dr. Sigrid Yesi, some of the research in humans has shown that attention span and several other aspects of cognition may not normalize even with 3 days of recovery sleep, raising the question of lasting injury in the brain. After hearing all the effects and ways sleep insomnia could impact our body and brain, many people want to know what's the prevention to this and what the treatments look like. According to the Mayo Clinic, changing your sleep habits and addressing any issues that may be associated with insomnia, such as stress, medical conditions, or medications, can help restore restful sleep for many of the people suffering. If these measures don't work, your doctor may recommend you to get cognitive behavioral therapy, medications, or both. To help improve relaxation and sleep, there are also prescription medications that can help you with your sleep, such as esopiclone, ramotillone, xylophone, or zolpidem. If going to the doctor is not your route, then there are many home remedies that you can try to help you out. Some basic tips can be staying active with some exercise a couple hours before sleep, and stick to the same sleep schedule and try not altering it, which can lead to difficulty sleeping. You can also avoid or limit the amount of naps you take, because napping throughout the day can make you not as tired at night and change your sleeping schedule. Also, stop trying too hard to sleep, because the harder you try to stay awake, it'll become harder trying to sleep. It'll keep you awake. Some alternate medicine you could get could be melatonin, Valerian, acupuncture, or medication. It all depends what works for you, because all the results to help are different. And yeah, that's what my brochure says. Thank you.